Hi, this is Mark Struthers. Today we'd like to look at cancer and the baby boomers. They say that cancer is a disease of aging. And let's take a look at our aging population, the baby boomers. As the baby boomers march forward to old age, they'll find that their bodies are changing. With these physical changes that we can see, we also need to look at the cellular level and see the changes that are happening there. Aged tissue can lead to aging and degenerative diseases. It can also lead to a greater risk for cancer. As the cells age, they are reproducing, but there's a lot of stress and damage that happens over time in this process. This can result in a pre-neoplasia, which is a tumor, and finally a cancer lesion. As 10,000 baby boomers reach 65 years old each day, the incidence of cancer since 2010 is estimated to increase by 67% by 2030. Another interesting fact about this generation is that they have higher rates of cancer at younger ages than previous generations. This may be that this generation has been impacted by obesity, heavy drinking, and smoking. Notice the number of celebrity icons. Can you identify with a few of them? Baby boomers were born in the years between 1946 to 1964. This generation is putting quite a strain on our healthcare system. Cancer is widely accepted as a disease of aging, with aging being the single greatest risk factor for developing cancer. The peak years for this occurrence are the ages of 65 to 74. Cancer also occurs at a high rate in people older than 75, but at that age, people are more likely to die from other medical conditions. From birth to death, a male born in the United States has a 40% chance of developing invasive cancer, while females are just slightly less likely to develop cancer in their lifetime, with the probability of about 38.5%. We use high-dose radiation therapy to help treat cancer and low-dose ionizing radiation to help find cancer. So this would be the diagnostic imaging. High dose is deterministic. In other words, we know exactly where the threshold doses are that cause damage. Low doses, like we receive in diagnostic imaging, we have a stochastic effect. This means random. In other words, there may or may not be a chance of you getting cancer. We just don't know. It could be one X-ray could cause cancer, but the probability of that is like going out into the sun for 1 minute in your lifetime and having cancer happen to you because of the ionizing radiation coming from the sun during that 1 minute. In both cases, the probability is almost impossible. So let's look at some of the basic types of treatment for cancer. We begin with surgery. Obviously, if we cut out the tissue with cancer cells, the cancer is gone. That's the primary thing that we're looking at is surgery. We also use chemotherapy, and these are specialized medicines that shrink or kill cancers that we cannot see. We also have radiation therapy, which uses high energy X-rays to kill cancer cells. Remember, this is the deterministic use of radiation. In addition to surgery, chemotherapy, and radiation therapy, we have immunotherapy, targeted therapy, and hormone therapy. Let's take a look at radiation therapy, which uses high-dose ionizing radiation and is administered in two ways, from outside the body and inside the body. How do we cause cell death using radiation? There are two ways that the radiation affects a cell. There is a direct effect on the cell and an indirect effect. The radiation can directly kill the cell itself, or it can cause an ionization within the cell that causes a chemical reaction that kills the cell. When the damaged cells die, they are broken down and removed by the body. Radiation therapy does not kill cancer cells right away. It takes days or even weeks of treatment before the DNA is damaged enough for the cancer cells to die. Then cancer cells keep dying for weeks or months after radiation therapy ends. Healthy cells that are damaged during radiation treatment usually recover within a few months after the treatment is over. But cancerous cells are more sensitive to ionizing radiation. Sometimes, though, people may have side effects that do not improve. Other side effects may show up months or even years after radiation therapy is over, and these are called late effects. These images demonstrate cancer cells and normal cells, and before treatment, during treatment, and after treatment. This image shows a high-dose radiation therapy machine applying radiation to a tumor directly. To spare the healthy tissue around the tumor, we use a process called fractionation. In other words, we hit it from many different angles, and the sum of the hits will kill the cells that are in the tumor, but it will also not kill the cells that are healthy around the tumor or damage them too much. Now let's look at an indirect effect wherein we take a radionuclide and inject it into the patient's bloodstream, and it goes throughout the patient's body. It seeks out the tumor. Cancers are called sugar eaters because they need energy to grow. Using a radionuclide that targets the sugar, we're able to get the killing dose or the radiation dose to the tumor itself. This spares surrounding tissue. The radionuclide decays within the tumor cells, emitting a positron. We are able to look at this positron using positron emission tomography to make sure that we've got an adequate dose to the correct area. Cancer treatment is expensive and it varies throughout the country. Survival rates for cancer patients using radiation therapy can vary widely depending on a lot of different types of factors, such as the type of cancer, the position of the cancerous area, the overall patient's health, and the patient's age, the surgeon's experience, and the facilities available in the hospital. Treatment for cancer is specific and expensive. That's why many patients go to MD Anderson Cancer Center in Houston, Texas, or Sloan Kettering in New York, which are the top 2 cancer treatment centers in the United States, to get their treatment. The reputations of these 2 facilities make the patients feel more comfortable that they are getting the best care possible. As we talked about earlier, radiation not only kills or slows the growth of cancer cells, it can also affect nearby healthy cells. And damage to healthy cells can affect the patient and cause side effects. So let's take a look at the treatment areas and the possible side effects that occur in a patient when we are treating that specific area. If we talk about a brain tumor, we're going to have fatigue, hair loss, memory or concentration problems, nausea, vomiting, skin changes, headaches, and blurry vision. These are the possible side effects for a brain tumor, whereas if we had a breast cancer, the side effects would be fatigue, hair loss, skin changes, swelling, which is edema, and tenderness at the site. When we treat for cancer of the chest, we end up having fatigue, hair loss, skin changes, throat problems such as trouble swallowing, cough, and shortness of breath. The side effects that you will receive when having head and neck treated are fatigue, hair loss, mouth problems, skin changes, taste changes, throat problems again, such as trouble swallowing, and a less active thyroid gland. Let's take an example of this breast cancer. Cancer destroys tissue locally, but it can also metastasize or spread throughout the body. It spreads usually through the lymphatic system or the circulatory system or bloodstream. Most cancers spread through the lymphatic system. That's why we're looking at lymph nodes, the cancer lesion, and the area of damage to the breast itself. In mapping the organ, the lesion itself will tell us what damage is done in the local area. We also want to take a look at the lymphatic system because cancer cannot skip a lymph node. It has to go from lymph node to lymph node. So we can actually see the progression there. Cancer treatment can cause late side effects that may not show up for months or even years after treatment. Some of the most serious of these problems, other than having a recurring cancer, is that late effects may include heart and lung problems. And this is due to chemotherapy drugs or radiation therapy damaging tissues in the chest. You may also get bone loss, eye and hearing changes, lymphedema, slowed or delayed growth and development in your bones. The late effects are more prominent in children. Obviously, they have a longer life left to live after treatment than an older person receiving the same treatment. Therefore, they have a higher probability of a late effect. One of the effects on children is changes in their sexual development and their ability to have children. They can also have learning problems and have an increased risk of other cancers later in life. As we discussed earlier in the presentation, women have a lower risk of getting cancer than men, and men have a higher risk of being diagnosed with invasive cancer than women. The American Cancer Society estimates that nearly 2 million new cases of cancer will be diagnosed in the United States in 2023, and more than 600,000 will die from the disease. We can also see by the increases in the percentage of types of cancer that happen to this population of the baby boomer that there are increases between the previous generation and the baby boomer generation. For example, colorectal cancer goes from 50% to 65% in this age group. As we noted, people are living longer today, and therefore there's more probability of them having cancers. So let's take a look at how the world is aging. We'll start at 1955 and project forward. Thanks for watching, and we look forward to seeing you in the future. This is Mark Struthers.